minutes, slightly perhaps more if it takes more, to present your abstract. Please go ahead.
Hi, I'm Nehali, and together with my colleagues Richard Gann and Adnan Kabir, we're going to talk to you today about an audit that we've completed recently on whether or not Foundation Year 1 doctors are receiving excellent quality feedback. Since the introduction of the European Working Time Directive in the NHS, there's been a significant decrease in the amount of time available to train a doctor due to increased patient demand and decreased training opportunities. There's been a new structure that's been maximised for supervised training opportunities. And these are supervised learning events, which were introduced last year. And these are interactions between junior and senior doctors, which can be in the form of an observed clinical encounter, a performed procedure, a structured discussion of a clinical case, or a trainee-led teaching session. And this should ordinarily lead to immediate feedback and should be formative in nature. So our aims for this audit were to evaluate the feedback that was received during SLEs from F1s and identify areas to improve. So the methods that we adopted for this survey audit were from the University of Edinburgh's Feedback Standards and Guiding Principles that stated that good quality feedback should be prompt, informative, helpful, reflected and acted upon. So we collected data using a survey questionnaire that consisted of Likert scaled questions, and we distributed this to 29 Year 1 doctors and asked them to rate how well their feedback was received and how it fared in these 5 areas.
So we present our results in the form of stacked bars, and we have highlighted positive responses in shades of blue. So when asked how prompt verbal feedback was, it was encouraging to see that 80% of the first-year doctors said that they received verbal feedback within an hour. However, it was less encouraging to see that written feedback was only received within an hour by 2 out of the 29 first-year doctors. When asked how helpful feedback was, it was also less encouraging, with 10 out of 29 of the first-year doctors saying that the feedback they received were helpful or very helpful, so less than 50%. %40 of the first-year doctors had their strengths highlighted within the feedback received, and only 10 out of the 28 first-year doctors had areas of improvement highlighted during the feedback received. And less than 50% again, only 37% of the first-year doctors had advice on how to improve within the feedback they received. However, it was more encouraging to see that the vast majority, 67% of the first-year doctors, acted upon their feedback received during supervised learning events. However, only a small minority, 2 out of the 29 first-year doctors, wrote a reflective entry on the feedback they received. So in conclusion, the main areas that need improvement are the promptness of feedback given, especially written feedback, highlighting strengths, weaknesses, and ways to improve, and reflection by the first-year doctors on the feedback they received during supervised learning events. We have presented these results to both senior and junior doctors in our hospital, and we think that this audit should be carried out regularly to assess any improvement in this crucial aspect of medical education. Thank you very much. Any questions?
Thank you very much to you all, the colleagues from UK, for presenting your abstract. I now open the floor for any comments or questions. If you have any question, you may type in the question, or you can just raise your hand so that you can unmute your microphone. Just for the information of all the attendees, a copy of all the abstracts will be provided in the conference abstract proceedings, which will be released after the conference. So you may refer back to all the abstracts, and if you have any question, obviously you can get in touch with the authors. All right, there is a question for you. Just posting it in the question box. Please refer to the question box and read it out the question and then answer the question, please.
Okay, where's the question? One second. I'm sorry, you can't see any question.
Right. So the question is on what are the next steps for this project? A question raised by Dr. Nazira Dawood.
Well, this is obviously the first phase that we have done, and obviously, as you know, the training of junior doctors is quite important because we all learn from seniors, and the reason they can learn is if they would be given quite a constructive feedback thing. So as you've already looked at the conclusion, you know, there are certain areas we still need to improve on, that is giving prompt feedback, and obviously doctors need to basically reflect on their learning as well. So what we would do is we would like to continue this audit after every 6 months to see whether we are maintaining that quality, and obviously junior doctors are getting adequate feedback for their learning purposes. So it's going to be an ongoing thing. So hopefully once we have completed around about 4 cycles, we can probably write a paper on it to see whether constructive feedback helps junior doctors in their learning or not.
All right, thank you very much, Dr. Richard, and the colleagues as well for the very interesting